I'm Daniel Wagner. I'm a registered pharmacist, MBA in International Studies, and I got my PharmD in 2000. I own and operate Nutrifarmacy here in the North Hills in Hampton Township. This is our 14th year. And I just love what I do because I think I really have time now to see patients, and I see maybe 7 or 8 a day for an hour, and we evaluate many aspects of their health. You know, a holistic way for me is to look at prescription medicines and vitamins and supplements and diet and exercise and good night's sleep and heredity and even spirituality. And you say, what's the most important? They're all important. So whether we're talking about asthma or diabetes or cancer or just depression, it's very relevant to look at this more integrative approach. You know, by holistic we just mean whole. Nothing new age about it. It just means looking at many other aspects. As if 70% of people are taking a vitamin or an herb or a homeopathy or amino acids, who answers the question? I'm on Synthroid, or I'm on a blood pressure pill, or I'm taking Coumadin. Is it okay if I take echinacea? Or what about St. John's wort? I want extra vitamin C. Really relevant question. Why? So many people are taking these. So, it's best that they get a professional answer. And, whether it's a pharmacist or a physician or a nurse, this is what people want to hear from. And there's another whole aspect of what we call nutrient depletion. This is a big area. You're taking metformin for diabetes, you deplete B12. You need B12. You're taking a statin drug, you need CoQ10. Extremely relevant. And there's so many aspects about that, so I really work on that too. So number one, acid base. There's nothing more important than keeping the body alkaline. When our body's in an acidic environment, it's an inflammatory environment. And the whole concept from Europe that cancer lives, thrives, and grows in an acidic environment is very relevant, but we don't look at that here. So, number two, the immune system. How can we keep the immune system up today with food alone? It's very difficult. And these doctors would say, we need some vitamin C, and we need some fish oil, and we need some selenium, and we do. It's very difficult because we're in such an environment. And that's the third issue. Why doesn't the medical profession just recognize how environmental factors are affecting us? Pollutants, toxins, pesticides, herbicides, radiation from cell phones, radiation from computers. These are extremely relevant. And we're seeing actually a mutation of a lot of the parasites and viruses all over the world. Lyme's disease is not the same as it was 15 years ago. It's been mutated. So these are factors that we didn't have. We didn't have cell phones 20 years ago. Now everybody has one. Is this affecting our health? Absolutely. But it's very hard to measure because we don't do research on it. Fourth, I would say, is the dietary approach. I see many cancer patients, and I have sometimes their oncologists would say something like, it doesn't matter what you eat. And you think about that. Logically, just be an intelligent human being, does that make any sense? Okay. Well, it wasn't taught in med school, or it wasn't taught in pharmacy school. It's not relevant. Well, I can't accept it. So I think we have to look at diet today. And we have incredibly amount of processed food, genetically modified food, junk food. So if we can get organic, everybody knows that's better. We've got to pay a premium for it, so it's an issue. And I would say the fifth aspect of what the medical profession is missing and refuses to recognize is probably the current issue with molds and funguses, probably more so than bacteria and viruses. There's an incredible amount of toxic type fungus, aspergillus, malolacea, of course candida is a problem. And of course candida is certainly proliferated by too much antibiotic use. Antibiotic abuse is a big problem nationwide, worldwide. So these doctors in Europe are starting to look at, what is the ramifications? And they would say that many, many households in America have so much mold, they should probably be abandoned. Well, it's not easy to do, but it's living in an environment where you're going to be in a state of sickness. My real passion as a practitioner, I would say, is medicinal plants. Okay, what really interests me is what drugs are derived from nature, mostly natural plants, mostly rainforest plants. So 1995 I started this Student Rainforest Fund, where I've taken, for our 16th year now, up to 20 to 30 students, American students, mostly pharmacy students, but it could be naturopathy and it could be biology and some are pre-med, to the rainforests of Costa Rica, Belize, Ecuador, Peru, to kind of get into the roots of their profession. It's really ideal because we have a practice very much like a physician practice. People always make appointments and they come in, and we spend a lot of time with them and do a lot of follow-up, and it works quite well. I do think pharmacists are just a real keen position for this because, again, they're accessible, they're trusted, and that's what people want. They really want to hear from a professional. We don't want them to get all their information on the internet or from somebody who's selling their vitamins out of the trunk of their car, and that does happen a lot. So I think there's a big area for this for health professionals, and I just think pharmacists are in an ideal position. So it's a wonderful career.